So, body shaping, minimally invasive approach. So, I have no conflict of interest for this lecture. So, interestingly, there are non-surgical skin tightening procedures are actually arising, and body shaping and tightening procedures, we see them more and more, and we do them more and more. And the market is actually growing, even though I have to say that it's in my clinic, it's not growing so very fast, but it is growing. There is a movement in the non-invasive body shaping direction. Now, interestingly, 70% of females are concerned about body fat, and more than 90% of females would like to change certain features in their body. And 1 in 3 have considered a procedure to get rid of their fat. Now, there are different non-invasive or minimally invasive body shaping procedures. So we have cryolipolysis that treats fat by cold. We have lasers that treat fat by heat. We have radiofrequency that treats fat by heat, and ultrasound that can treat fat either by mechanical, just like I was told before, like ultrashape, or also by heat. Now, ultrasound or sound is a pressure wave. When I'm talking to you, we're having pressure waves in the air, and so in this way you can hear me. Now, ultrasound are the frequencies that are above the audible range. And ultrasound technologies, ultrasound can be either focused or non-focused. Focused ultrasound here, such as ultrashape, you can have the energy concentrated in a targeted focus area in the fat tissue. In non-focused ultrasound, such as the Slimmy, which is a very new ultrasound device and very nice, you have non-focused ultrasound, and the highest intensity in this device is at the contact sites. So actually the energy is has to bypass the skin. So ultrasound, okay? We can be divided into several groups. It can be focused or non-focused, but it can also be low frequency versus high frequency, okay? So low frequency ultrasound is, as I said, ultrashape, and then you will have a mechanical effect on tissue. Оно ломает жир механически. High frequency ultrasound technologies, высокая фреквенция, they actually break fat by heat, such as liposonics, Ultera, Slimmy, they all heat tissue, okay? So it's a thermal tissue effect. Now, adipocytes, fat cells, are heat sensitive, okay? Well, there are several studies showing that adipocyte cannot live when we heat tissue. So we can heat tissue to 50 degrees for 1 minute and lead to apoptosis, fat cell death, but we can also heat tissue 3 minutes to 45 and then also see apoptosis, or we can heat tissue for 15 minutes to between 43 and 45 degrees and also get some fat cell death. Now, this fat cell death is very interesting because it's an apoptotic process. It's a slow fat cell death. They die slowly, okay? And at day 9, you can see phagocytosis at the fat cell tissue, which means that there is actually breakdown, phagocytotic breakdown, and there is no increase in lipid levels in any of the studies that have been done. Now, this is the Slimmy device. It's a new device, a new ultrasound technology device by Lumenis. It has uniform ultrasound. It's non-focused, as I told you. It's a new technology, and it's a high-intensity ultrasound, so that the effect will be heating of tissue. Now, it has, as I told you, ultrasound, also bipolar radiofrequency, it has vacuum, and it has cooling. It's when we heat tissue from above by ultrasound, by non-focused ultrasound, it's very, very important to cool the surface as not to damage the epidermis, and also for the patients not to sense pain. Cooling is very, very important. So this is what it has. It has ultrasound, it has protective cooling, very, very important, we'll talk about it. It has pulsating vacuum, and it has also radiofrequency inside the device, also to stimulate a little bit more of tissue tightening. Now this is how it works. Here you put the transducer on the skin surface, then it will transduce the ultrasound here, and then this acoustic energy, what happens is that this plane wave actually propagates into the tissue, and it is attenuated in tissue, and the acoustic energy is converted into heat. Okay, so we heat tissue. Here you can see how these transducers work, and they heat the tissue, and because several transducers are there and the energy is going to the same area, actually a certain area in tissue will be heated the most, and that is the area that we want to heat. And also there is protective cooling. So you can see here, this is the applicator. We actually cool the tissue, then we put the ultrasound. The energy is going, heat is inserted into the body by radiation and is extracted by conduction due to cooling. So the skin is cool and the fat is cold, and this is how it works. So it pulls up. This is the handpiece. The vacuum is activated, the skin is elevated, and so we always heat the superficial adipose tissue that we want to heat. These are the handpieces. There is one that is hexagonal, one that is rectangular, and it's we can treat the full mostly we treat the abdomen, and here in the hexagonal treatment you have to cover 12 to 16 areas, and in the bigger applicator we cover 4 to 6 areas for full abdomen. So this is how we cover the abdomen, and this is how patients look directly after the treatment. So there is actually very minimal, you see very minimal redness, very minimal swelling. It's not like with the other devices that we have that introduce a lot of inflammation. There is very, very limited, actually you don't see so much after the treatment. And this is the hexagonal applicator. So you can see, just a minute, there is a video here. The energy is going from 6 plates from the sides and actually heats the tissue very, very fast. It takes 96 seconds to heat the fat tissue, where we want it to be, and then we keep this temperature, this 48 degrees. We are heating to 48 degrees, and we keep it for 2 minutes after. So it's a very fast treatment, okay, for an area. What you see after is apoptosis of the fat. Actually, there is fat cell death. Mostly we have apoptosis. There is very little necrosis too, but most of the effect is apoptotic. So histology, initiation of inflammation, vasodilatation, blood congestion, and neutrophil infiltration. Day 9, you already have some paniculitis. This is good because there is infiltration by macrophages and multinucleated giant cells, and there is some coagulation necrosis here. So fat cell death, that's what we want to have, and we can see that there is also apoptosis there. This is a study that was done in the UK by Dr. Otto, and it was published in Laser Surgery Medicine. There were 21 patients included, and what you can see is that there is a circumference reduction of up to 4 centimeters, as was said by Dr. Mulholland. Mostly circumference reduction by all these devices will be between 1 to 4 centimeters, and the results are seen, the maximum results are seen after 3 months. And these are some clinical results before and after. And here you have the ultrasound with 22% reduction of fat. And this is also before and after. And these are satisfactions. So at 1 month, it's between 67 and 80%, but at 3 months, the satisfaction is very high. It's between 86 and 100%. And these are other results. So sometimes you get better results. This is 6.5 centimeters reduction from Dr. Ancona from Italy. And this is also 7.5 centimeters reduction also from Italy. And this one, in Italy, they have more reduction after the treatments than in the UK, which is interesting. Maybe the food is different and their fat is... so in Italy, they have better results. And this one is from China, with 2.4. So maybe the Chinese don't have so much fat, actually. Okay, anyway, comparing to other devices. Safety, it's very, very safe. It's ultrasound energy. We know it's very, very safe. It doesn't go deep. It's just at superficial adipose tissue. So there is no problem with the energy going deeper. It's a large volume, and we can actually go very fast. The treatment is quite fast. It takes less than an hour for a full abdomen, which is great. If we compare it to liposonics, you know, liposonics, for instance, has heating much higher, heating up to 60 to 70 degrees, which means there is a lot of inflammation, a lot of necrosis. So the experience of the patient is much more difficult, and it also gives just up to 4 centimeters. So compared to this, Slimmy is much, much easier on the patient. Comparing to school sculpting, it is shorter. It is a shorter procedures. It takes about 35 to 60 minutes. I mean, by cool sculpting, and here actually we kill much faster the fat cells. Also, with cool sculpting, the inflammatory response is much higher, so we have less inflammation, and you have the risk of paradoxical adipose hyperplasia. Especially, I think the time of treatment is shorter here with the Slimmy, so it's quite fast as compared to other technologies such as sculpture or cool sculpting, and it's also very effective. So, in conclusion, in recent years, tremendous advancements in non-invasive body contouring, high-intensity, non-focused ultrasound technology, the Slimmy, is both tolerable, effective, and safe, and I think it is one of the best new modalities on the market for non-invasive body contouring. Just a word about ESCAD. I would like you all to become members of the European Society of Cosmetic and Aesthetic Dermatology. I'm now president there, and we have meetings together with the EADV, with the European Academy of Dermatology. We had one in Vienna, will be one in Brussels, May 24th, and we will have one in Geneva together with the EADV if you're coming to Geneva, our board, and thank you.